Britain is hurtling towards a second all-out lockdown as figures show the coronavirus epidemic now doubling in size week on week. The government's scientific advisors claim the national R rate could now be 1.4, meaning on average every 10 people infected are infecting 14 others. Nationally, there were a further 4,422 confirmed UK cases of coronavirus recorded on Saturday and 27 deaths, up from 4,322 confirmed cases on Friday, the first time the daily total of positive tests had exceeded 4,000 since May 8. The government's original lockdown architect, Professor Neil Ferguson of Imperial College London, warned tougher restrictions were needed sooner rather than later. The epidemiologist, who resigned from government scientific advisory group SAGE in May for flouting his own lockdown rules, said, "Right now we're at about the levels of infections we were seeing in late February. If we leave it at another 2 to 4 weeks we will be back at levels we were seeing more like mid-March. That's going to clearly cause deaths." But Chancellor Rishi Sunak has warned against introducing new blanket restrictions by pointing to huge damage already inflicted to the economy. Parts of England are already being forced back into lockdown in a bid to flatten the curve, with rules including a 10 p.m. curfew on pubs and restaurants and a ban on socialising outside of households. These are now in place in the northeast and start on Tuesday in the northwest, Midlands and West Yorkshire. At least 13.5 million people, roughly a fifth of the UK population, are already facing local restrictions. Despite this, the Office for National Statistics (ONS) said there has been a marked increase in infections across country and through all age groups, with hospitalisation among older people growing and the death rate beginning to creep up. Admissions for coronavirus are doubling every 8 days, and there has been a surge in the number of patients needing intensive care. There are currently 988 COVID-19 patients on wards in England, up from 425 at the start of the month. It takes about 3 weeks for a rise in the number of cases to translate into an increase in deaths. There are signs this is happening, with a further 28 reported on Friday. After mortality rates staying in single figures for much of July and August, the number dying within 28 days of a positive coronavirus test has risen above 20 for the past 4 days. At the peak of the pandemic, more than 1,000 were dying every day. SAGE said, "The higher R is above 1, the faster the epidemic is growing. We are concerned that the current doubling time could be as quick as every 7 days nationally, and potentially even faster in some areas of the country." This increase on last week shows we are moving to wider spread growth in transmission at a faster rate. Close quote. The ONS said an average of around 6,000 people in England were infected every day last week, compared with 3,200 the week before. Health Secretary Matt Hancock said a national lockdown was the last line of defence. But he warned that it was a big moment for the country, telling Sky News, "The virus is clearly accelerating across the country. We have got to take the necessary action to keep people safe. We will do what it takes." Close quote. The sharp rise in UK cases over the last 2 weeks comes amid continuing problems with the government's much criticised test and trace system. key workers whose children have been sent home because of school infections have been unable to find out if they have the virus, so have had to stay away from their workplaces. Do we need a second lockdown? Yes, writes heart specialist Dr. Dominic Pimenta. We need a short lockdown, as soon as possible. Cases are doubling every 8 days, so the longer we wait, the higher the number of people in hospitals, and the longer any shutdown will have to be. It doesn't need to be as severe as last time, but making it national is key. Many are not complying in local lockdowns as they look to the next borough and see they're doing things they are not allowed to do. Infection is spreading in bars, restaurants and workplaces, and just rolling it back to home working and takeaways will have an impact. Wait any longer, and we risk school closure. I've seen firsthand the devastation of this virus. Patients need 6 to 8 weeks on a ventilator, but can't have it if the NHS is overwhelmed. It's not a matter of choosing COVID-19 patients over people with other health problems and diseases. It's about resources, and there's not enough in the NHS to deal with both. No, says cancer specialist Prof. Carol Sikora, we should not have a second lockdown as the number becoming ill is very low, and a fraction of what it was at the height of the pandemic. It's mostly the young getting the virus, and they are healthy enough to not fall seriously ill. The key to moving forward is not a universal lockdown or policing behavior, it's an individual risk assessment. Those who are vulnerable have already died, and those at risk or scared are mainly shielding themselves. If you are healthy, you should carry on, and, if not, it's better to avoid environments where you don't control social distancing. Another lockdown, which would shut down all hospital services, will add to waiting lists for patients in every section. Politicians are stuck. They've listed options, and epidemiologists have no idea how effective certain measures will be. The most damaging thing would be to close everything down